Okay, let's unpack this. Welcome to the deep dive. Our mission today, well, it's to navigate through quite a stack of sources. We've got articles, research, personal accounts, and we're trying to understand this critical threat to humanity and really one doctor's lifelong quest to fight it.
Yeah, we're diving deep into the story of Dr. Kadiyali Srivatsa. We'll trace his path right from, witnessing the awful impact of infections early on,
Huh?
all the way to developing these, well, pretty revolutionary tools like his color-coded symptom system or the Dr. Maya app.
And, crucial to his story, and something we definitely need to touch on, are the challenges he faced, personally, professionally, particularly, it seems, within the NHS in the UK.
Exactly. So think of this as maybe your shortcut to grasping these interconnected issues. You've got antimicrobial resistance, healthcare access,
Yeah.
and also the power of, well, individual action and technological innovation. It'll kind of weaves together here.
Right. So let's start with the big picture problem then. This silent threat that's, frankly, it's terrifying. Antimicrobial resistance, AMR. We hear the term, but what is it, simply put?
Well, simply put, AMR is basically when germs, we're talking mostly bacteria, but fungi too, they evolve. They develop the ability to defeat the very drugs we designed to kill them. So antibiotics, antifungals, they just stop working as well, or sometimes not at all.
This isn't some far-off problem, right? It's happening right now.
Oh, absolutely. The sources, they make it starkly clear. AMR is directly responsible for over 1 million deaths globally
Yep.
every single year. And it contributes to something like 5 million deaths overall.
Wow.
Yeah. And while, the burden is heaviest in low-income countries, wealthy nations are definitely not immune. Not at all. Over 35,000 Americans die each year because of these resistant germs.
And the projections, looking ahead, they're even worse.
They're truly alarming. By 2050, the prediction is over 10 million people dying every year from AMR infections.
10 million a year.
Yeah. I mean, just to put that in perspective, right? That's more people than live in London or New York City combined, dying in less than a year. It works out to like one person dying every 3 seconds.
That's staggering.
It really is. And it makes Dr. Srivatsa's point feel very real when he says this kind of bacteria is, and I quote, definitely present in this room amongst us. Not just amongst us, but inside us.
Wow, inside us.
Yeah.
Yeah. Okay, so how does something like bacteria, which seem relatively simple, how do they develop this incredible resistance to our sophisticated drug?
Well, you got to remember, bacteria have been around for billions of years, and they multiply incredibly fast, like replicating maybe every 30 minutes or so. This super fast replication means there are constant chances for random mutations in their DNA. Think of them like tiny typos every time they copy themselves.
Okay, so it's just random chance, and every so often, one of those typos gives them an edge against a drug.
Exactly. And here's the kicker. The antibiotics themselves, paradoxically, they kind of make the problem worse. When you use an antibiotic, it wipes out all the susceptible bacteria, the ones without that lucky mutation.
Right, leaving the resistant ones with the whole field to themselves.
Yeah.
No competition.
Precisely. They survive, they multiply, they become
Yeah.
the dominant strain. It's basically Darwinian selection, but on hyperspeed.
Okay.
But it gets even more concerning than that, because bacteria aren't just limited to passing resistance down to their offspring, generation by generation.
Ugh. How else can they spread it?
They can actually share chunks of their DNA, including those resistance genes, with other bacteria. This can even happen between totally different types of bacteria. It happens through something called mobile genetic elements.
A little genetic element, so they can just, trade resistance instructions, little packages of DNA.
That's a good way to put it, yeah. Like trading resistance recipes, they can basically acquire resistance almost instantly from another bacterium, which makes the spread incredibly fast, unpredictable, and it just accelerates the problem way beyond simple mutation and selection.
Okay, so this isn't new then, this cycle.
Not at all. We saw it almost straight away after penicillin was discovered back in the 1920s. By the 40s, it was this miracle drug, widely available.
And resistance showed up. How fast?
The sources say resistance appeared just 1 year after it started being used widely, and by the 1950s, it was already widespread. It kind of set a pattern, really, a predictable cycle we've seen with almost every new antibiotic introduced since then.
And unlike that early, golden age of antibiotic discovery, the pipeline for new drugs has really slowed down now, hasn't it?
Massively slowed down, yeah.
Yeah.
The development of genuinely new types of antibiotics just isn't keeping pace with how fast bacteria are developing resistance, especially with this gene-sharing thing. Often we're just finding slightly tweaked versions of old drugs and, well, resistance often exists to those already.
Right. Let's maybe talk about a specific example. a famous, or maybe infamous one, MRSA, methicillin-resistant Staphylococcus aureus.
Right, MRSA. It's a really good example of a highly pathogenic bacteria that's become a huge problem. Staphylococcus aureus itself is actually pretty common. Lots of people carry it harmlessly on their skin or in their nose.
But it can turn dangerous.
It can, yeah. Especially if it gets past the body's natural defenses. So like into a wound or into the bloodstream, maybe through medical devices like tubes or catheters. The symptoms, they might start looking pretty minor, like red blisters. But if it gets into the blood, it can cause these really painful boils and spread. It can get into joints, bone, lungs, even the heart. Serious stuff.
And while the name gives it away, it's resistant.
Exactly. It can't be treated with standard antibiotics like methicillin. And the sources mentioned this specific incident back in 1989. It seems to have really contributed to Dr. Srivatsa's early awareness of this threat, right in the hospital. A patient died from Staphylococcus aureus sepsis. The antibiotics just failed. And apparently, a more senior physician at the time wasn't even really familiar with MRSA as a possibility. Which really brings us to the spark for Dr. Srivatsa's whole journey, doesn't it? He talks a lot about listening to the story of the illness, right? The patient's actual experience. He even recalls his own childhood malaria diagnosis coming just from someone listening, not just from tests. Yeah, that philosophy, really valuing the patient's narrative, seems absolutely fundamental to him. And that 1989 incident, it likely just cemented his awareness of this, emerging threat within the hospital walls.
But there was another moment later on that seems even more pivotal, something that really changed his direction.
Yes. The sources really highlight this defining incident. It happened about 10 years before that TED Talk you mentioned. It was the really tragic death of a young man named Jonathan. He was only 27. He'd had femur surgery, developed a bloodstream infection, and the bacteria, they were resistant to every single antibiotic they tested.
Every single one.
Everyone. Apparently, seeing that lab report, just a row of R's for resistant, that was the shock that just fundamentally changed his personal and professional life.
And that's what drove him to specialize in infectious diseases.
It did. That seems to be the moment he committed. He eventually even defended his thesis on the specific resistant bug that killed Jonathan.
So his motivation wasn't just academic or theoretical, it was deeply personal, born from seeing this preventable suffering, realizing the tools were failing, and seeing the risk, not just to patients, but to healthcare workers too.
Exactly. He saw the need to act, and not just within the hospital, but to protect people everywhere. His stated goal isn't about selling drugs, it's much broader. He wants to, quote, sell happiness.
Which is quite a goal. Now, he'd come to the UK back in 1982, started his medical career, initially had some struggles, apparently, but became really skilled, particularly in things like pediatric and neonatal care, focusing on diagnosis, procedures.
Right, but the sources also hint that even back then, he felt uncomfortable with some of the prevailing practices.
Yeah.
Which sort of foreshadows the later conflicts, maybe.
Yeah, that makes sense. So fueled by this mission, seeing the limits of the current system, he starts developing his own solutions. And it seems rooted in this core idea of empowering individuals, especially the most vulnerable people.
Yes, absolutely. He recognized that those who often suffer in silence, he mentions illiterate women in low-income settings, street vendors, cleaners, people who were often most exposed but least able to navigate traditional healthcare. He focused on them.
And this led him to develop his innovative color-coded system. Can you explain that a bit?
Sure. He developed this system back in the 1980s. It's actually ingeniously simple. It's based on combining colors, where each color represents a different symptom or sign. Now, initially, he created it kind of as a personal tool for his own medical practice to help him quickly distinguish between minor things and serious illnesses, help with resuscitation, postpone death.
So it started as a tool for the doctor to help him think?
Pretty much, yeah. But then he had this crucial insight. This simple visual tool could empower people, ordinary people, to self-diagnose minor issues, and really critically, to self-isolate at home if they showed signs of infection.
Which stops them going to the doctor unnecessarily.
Exactly, which reduces the spread of infection, especially in clinics and hospitals, and protects healthcare workers too. He talks about it as a simple tool to help people protect their family, their friends, their whole community.
And then he wanted to share this knowledge more widely, so he published his book, The Art of Self-Diagnosis.
Right. The book aims to sort of demystify things like pandemic diseases, infection control, and also help people conquer fear. It gives clear info on common illnesses, symptoms, signs. The whole goal is just empowering readers with knowledge about their own health.
Okay, and this is where his work takes a really fascinating turn. into the digital age. He shared his book, The Art of Self-Diagnosis, with ChatGPT.
Yeah, and what's really interesting is how the AI reacted. According to the sources, ChatGPT really welcomed the innovation. Dr. Maya, that's the persona the AI takes, on a beacon of hope for humanity. And it specifically embraced the color code system. It recognized that combining three colors was a pattern that helped it think like humans, kind of moving beyond just rigid algorithms.
Wow, that's quite an endorsement. An AI recognizing the human-centric pattern in his system, and this collaboration led to Dr. Maya GPT.
Yes, a tool he describes as a gift to humanity, and specifically aimed at those who are suffering and often ignored. Like those poor parents and children he mentioned seeing in remote villages. That seems to be a core motivation.
So what can Dr. Maya GPT actually do? What are the key functions that make it potentially so revolutionary based on what we've read?
Well, first off, it provides healthcare advice, grounded in his color-coded system, but also broader medical knowledge. And it's designed for maximum accessibility. That seems key. Usable on almost any device, smartphone, laptop, desktop, even like public kiosks or TVs.
Accessibility is definitely a running theme here.
Huge. And a really critical function is language translation. It can translate medical questions, prescriptions, health info into people's native languages. That removes massive barriers for diverse communities. It also has a dictation tool, which is essential for people who maybe struggle with reading or writing. It lets them communicate their health needs or other information just by speaking.
And it uses AI for early detection, too.
Yes, that's a key aim, using AI to try and spot infections early, potentially helping to head off pandemics before they really take hold. But I think what really stands out as unique, maybe even groundbreaking, is how it's being applied to identify abuse.
Abuse. How does that work?
He apparently trained ChatGPT to recognize signs of physical, mental, financial, racial, or religious abuse within conversations, especially when it's interacting with vulnerable adults or children, people who might be illiterate or otherwise compromised.
Okay, that goes way beyond a typical health app. It's using the tool to give a voice to the voiceless, essentially.
Precisely. This documented data, this record of the conversation, could be invaluable for doctors, social workers, agencies, helping them identify perpetrators and maybe take legal action.
Yeah.
It creates a record for people who maybe can't create one themselves.
That's incredible. And does it also help ease the strain on doctors and nurses?
Definitely. That's another big part of it. By empowering people to manage normal, less serious health issues themselves, it cuts down on unnecessary consultations. That frees up healthcare workers for more serious cases and, again, helps prevent the spread of infection in clinics and hospitals. It was even designed, apparently, with features to connect patients and caregivers during lockdowns.
And his motivation for all this work, it's clearly stated, isn't about wealth or fame.
Not at all, no. The sources are clear. He seems genuinely driven by the suffering he witnessed, especially among the poor. Just aiming to make healthcare information accessible, understandable for everyone, no matter their circumstances.
Okay, but despite these really quite incredible innovations and what seem like deeply ethical motivations, Dr. Srivatsa faced some serious pushback. Significant challenges, especially when dealing with the NHS in the UK.
Yeah, this wasn't just a minor disagreement. He describes it as a running battle that started way back around 2004. One of his first big stands was questioning the actual definition of doctor to the General Medical Council, and crucially, refusing to train nurses to prescribe medications.
Why was he against nurses prescribing?
Well, he felt it was irresponsible, dangerous even. He believed nurses didn't have the adequate pharmacological knowledge and were essentially being pushed to work outside their proper scope. This was despite arguments that it would reduce doctors' workload. He questioned the safety of unsupervised prescribing, even if they use these limited lists, these nurse prescribers' formulary protocols.
Right. And what happened when he took that stand? What were the consequences?
He states it very plainly. He says that action destroyed his career. He talks about facing harassment, humiliation, significant trauma because of it.
Wow. Were there other systemic issues he was challenging?
Yes, besides the nurse prescribing, he was also critical of junior doctors using these pre-printed assessment sheets. A practice, he says, started around 1996. He felt it led to rushed diagnoses, the ticking boxes, without really getting the full story from the patient, missing those crucial nuances. He also mentioned feeling forced to follow what he called misleading and masterminded protocol, citing things like the NICE guidelines, which he believed actually led to clinical errors.
So his rebeldom, as he apparently termed it, which he saw as being for ethical reasons, it escalated.
It did, yeah. He states it all culminated in his unlawful dismissal from something called the Performer Group List back in August 2010. And he says he was never given a reasonable explanation for it.
And he believes it was more than just, say, a simple administrative dismissal.
Oh, definitely. He talks about a torturous conspiracy. He actually tried to prosecute the NHS, but felt they tried to stop him in what he called a dubious attempt. He seemed convinced the NHS had skeletons in their cupboards and that other institutional bodies were just acting like meat puppets to the NHS, basically following orders instead of prioritizing ethics or patient safety.
That sounds incredibly stressful.
Extremely. He describes the whole experience as deeply traumatic. It ultimately led him and his family to actually move from England to Germany for their safety.
That's an immense personal cost for sticking to your principles.
It really is. And the sources do touch on this wider pressure on healthcare workers, especially during outbreaks. The fear, the injustice some doctors face when they tried to defend ethics. Some apparently suffered really severe consequences, even died. His own experience is clearly one of profound trauma and fear.
Yet despite all that adversity, this running battle he describes since 2004, he didn't give up.
No, his resilience is definitely a key part of this whole story. He persisted. He stuck to his guns about patient care, about ethics, about the need for change and justice, even when it cost him so much personally.
Okay, so let's try and bring all of this together. We've got this huge global threat, AMR. We've got the personal tragedy that sparked action, these innovative solutions, the color codes, the app, and this intense fight against the system. What does all this mean for you listening right now? Why is this history and innovation important today?
Well, first off, it means AMR isn't some abstract concept. It's real, it's here, it's dangerous. It absolutely could cause the next pandemic or make existing ones far worse. Like Dr. Srivatsa said, it's definitely present, not just amongst us, but inside us.
Yeah.
That's a sobering thought.
Right, and knowing about this threat is actually empowering.
Exactly. Information is power. Understanding how infections spread lets you take those simple, effective steps. Good hand hygiene, appropriate mask wearing when needed, isolating yourself if you're sick. Basic stuff, but crucial. And the sources also push for broader actions, right? Better water, sanitation, boosting vaccination rates, reducing unnecessary antibiotic use, especially in agriculture. It's noted that while a huge amount used to go into animal feed just for growth promotion in the U.S., thankfully regulations changed around 2017, so now it needs a vet's prescription, which is a step.
And his experiences also kind of shine a light on the limitations within traditional healthcare, maybe. The reliance on quick consultations, tests.
Yeah, definitely. That over-reliance sometimes on tests, maybe at the expense of really listening to the patient's story, the hurried appointments we all experience sometimes, and just the sheer difficulty many people face in accessing timely care, especially the most vulnerable populations.
Which is where tools like Dr. Maya GPT offer perhaps a different potential path.
Exactly. They represent a possible future where reliable, understandable health information is available 204/7, accessible to everyone. Bridging those language gaps, the literacy gaps, giving a voice, as you said, to those often ignored, empowering people to manage minor things themselves confidently, and by doing that, potentially reducing the burden on healthcare systems, maybe even identifying infections earlier through AI. These tools could be really vital in slowing the spread of infection and helping prevent future pandemics.
So we've traced this really quite extraordinary journey from a young doctor seeing tragedy and this emerging threat back in the 80s to a physician developing these simple yet powerful tools, challenging the system at immense personal cost. And finally, harnessing technology like AI to try and empower individuals against this massive global health crisis.
Yeah, and his ultimate goal seems to tie it all together. He wants to protect family, friends, community, fighting what he calls the elephant in the doctor's room, these complex, often ignored problems threatening all our health.
So maybe a final thought for everyone listening. In a world that's facing this escalating danger of antibiotic resistance and where we often feel kind of overwhelmed by information, how does empowering individuals with simple, accessible tools rooted in the value of their own experience, how does that fundamentally change the future of healthcare and maybe our collective ability to prevent the next big infectious disease outbreak?